You have heard about anorexia, you have heard about bulimia, but have you heard of cachexia, specifically cancer cachexia? Yes or no? This is Dr. Arghya Basu, your friend, welcoming you all to one more interesting episode of our Healthy Chit Chat in your own YouTube channel. Let's have a good time together. Hello friends, this is Dr. Arghya Basu, gastro and cancer surgeon, welcoming you all to a very interesting episode of your own YouTube channel Arghya, where we discuss various gastro, cancer and surgery related problems and try to help our patients and viewers with accurate and state-of-the-art medical guidance, even at personal level. So let's come back to our discussion. Before that, if you heard about cachexia, please mention about it in the comments. I want to see how many of us or my loving followers actually know about cachexia. Now let me discuss what is cachexia. Cachexia is weight loss, severe weight loss, loss of lean body mass. Lean body mass is a purely technical term. I will call it as loss of exact solid part of our body, solid ingredients of our body. As all of us know that more than 70% of our body is actually made up of water, and the rest of the body is made up of different kind of solids, soft things and fluids, not necessarily water. Now, whenever a patient is suffering from cancer, the cancer doesn't affect the patient's body by its physical appearance. What does the physical appearance mean? A patient is having a breast lump. The lump is producing some localized effects because of pressure. It is involving the skin, causing an ulcer. It is spreading to rest of the body. These are all physical effects of the cancer. But there are some other chemical effects as well that is seen in distant parts of the body. The cancer is not sitting idly in your body. The cancer is secreting different kind of chemicals, and these chemicals are often hormones. These hormones are negative hormones. All other hormones in our body which are responsible for normal physiological activities are positive hormones. They give us positive energy. They give us growth, development. They help us in maturity of brain and body, give us sexual orientations. These are all positive functions, but there are some chemicals which have negative functions as well. These chemicals are called cachexians, which cause cachexia. Anorexia is loss of appetite. But when the loss of appetite is up to that grade, the patient is rapidly losing lean body mass or rapidly losing the normal, natural, solid ingredients of the body, so that whenever you are looking to the patient, you can feel that the patient is sick, severely sick. This is called cancer cachexia. One such chemical is TNF alpha or tumor necrosis factor alpha. Almost all the cancers secrete these chemicals in huge quantities. So these chemicals have their direct effect on each body cell, so that they push the body of the patient towards a negative metabolism. So what does a negative metabolism mean? Whatever the patient is taking as an intake, the output or the burning of calories by the patient's body as well as the cancer cells is much more than the input, so that the patient's body goes into a negative metabolism. Now you will tell me that the patient is sick. So how the metabolism is or the output is more than the input? This is by this simple equation. You are just thinking about the patient, but I am not talking about the patient only. The main consuming factor is the growth itself, the cancer itself. What does a cancer mean? A cancer means a lump or a mass of cells which are growing hugely, enormously, and it is having uncontrolled growth. So suppose you are having a business and your business is growing enormously. So what will you need? You will need funds, you will need workers, you will need feeding of the workers, you will need associated things that are necessary to run the service. So you need supplies. It is just like that way. Whenever a cancer mound or a cancer lump or cancer cells are growing enormously, they need supplies. From where these supplies will come? Definitely whatever the patient is eating. The patient is eating as per his own requirements, and his requirements or his mental capacity, what we call satiety, which is controlled by thalamus and hypothalamus in the patient's brain, is actually suppressed by TNF alpha or other cachexins, so that the patient feels the feeling of hunger at a much lesser extent than a normal person. So his intake is already reduced, and moreover, whatever the patient is eating, the maximum part of that energy or that calorie is going for the growth of the cancer cells and tissues. So on one hand, the patient is taking less amount of nutrients. On the other hand, maximum part of that nutrient is going for growth of the cancer itself without any growth or sustainability in the patient's body himself. So the patient's body is actually decaying, whereas the cancer cells or cancer mound is growing enormously. So what can we do for that? Please listen to the video till the very end so that you don't miss any vital point, and at last, where I will share with you the links how you can get in touch with me and get personalized advice and guidance. Now we will go to the treatment and further discussions part, but before that, if you are enjoying the show and अगर आपको कोई benefit मिल रहा है तो please ये चैनल को सब्सक्राइब कर लीजिए and बेल आइकॉन को प्रेस कर दीजिए, so that you will get notification every time we post a video, and this will give me and my team a huge inspiration for our hard work. Thank you. Now without any further delay, let's dive deep into the problem and how we are going to tackle it. So let's come back to our discussion. First of all, let us think, what is the source of energy or calorie in case of a cancer patient? Whatever he is taking, he can take solids, he can take fluids like that, he can take some supplemental feed in form of some supplements. Like in case of cancer patients who are undergoing chemotherapy or immunotherapy, who has reduced appetite, we always supplement them with supplemental feed or nutraceuticals, so that the patient is having adequate supply of carbohydrate, protein, fat, as well as vitamins, minerals, and of course water in his or her body. Now the first thing is, we have to ensure that the patient is taking adequately. How the cancer patient is taking? In most of the oral cancer patients, the patient is unable to take his or her feed through mouth, especially in case of advanced cancer patients or post-operative cancer patients. When we have performed a commando surgery or a huge extensive surgery for oral cancers, we often put the patient on Ryle's tube for prolonged feeding. Or when the cancer has grown to such an extent that the entire food pipe is closed, the patient, somehow we have managed to put in one tube through the patient's nose into his or her stomach. This is Ryle's tube. Sometimes in case of small intestinal cancers, we try to feed the patient with nasojejunal or FACRSI tube. We put in a nasojejunal tube, which is a very long tube, with the help of an endoscope into the patient's jejunum directly or middle part of small intestine, so that we can deliver elemental feed directly to the patient's small intestine. Now one thing must be kept in mind, here we are bypassing stomach, which has a maximum digestive capacity. So we have to supply the patient, to feed the patient with elemental feed, which is easily digestible at small intestine level. On the contrary, the patient may have a feeding jejunostomy, a feeding gastrostomy. What are these things? These are simply putting in tubes, external tubes, into a patient's stomach or into a patient's small intestine percutaneously. A tube hangs from the patient's tummy on over the stomach or over the small intestine, through which we feed the patient from time to time. But here the fallacy is, however amount of liquid feed or solid feed or formula feed that we can give to any patient, it is never ever equivalent to oral feeding, which is spontaneously taken by the patient in response to his or her feeling of hunger through hypothalamus or thalamus. Now this is the basic fact. However feed you might give, you are always running short of requirements to his or her body. So number one, the patient is having cancer, he is having reduced appetite or anorexia. We have to mitigate that. How we can mitigate? If the patient is taking by Ryle's tube or jejunostomy tube or gastrostomy tube, here the feeding is controlled by the feeding nurse or family members. You can feed the patient half an hourly, hourly, 2 hourly as prescribed by your nutritionist or your dietitian. Here the feeding is under your control. So take opinion of your dietitian or your nutritionist so that the patient can get maximum amount of calorie through minimum number of feeds. But when the patient is on oral diet, that is, the patient is not on any other kind of tube, but he or she is taking orally spontaneously, normally, normal feeding, but the patient is having reduced appetite. So if the patient is having reduced appetite, he doesn't feel to be hungry, so how you are going to feed the person? There are some drugs as well, like megestrol acetate. They are sort of progesterones. Progesterone is a female hormone, but it has some positive actions in the body, positive metabolic actions. Sometimes we use some sort of steroids, some type of progestogens or progesterone related compounds, which actually enhances the patient's feeling of hunger. It makes the patient hungry. Whenever the patient is hungry, feed him or her accordingly and try to give her adequate calorie and adequate protein, carbohydrate, fat, and as well as vitamin, minerals and water or nutraceuticals. But when the patient is on oral feeding, your first job is to ensure that the patient is hungry. If the patient is not hungry at all, even if you try to feed her biryani, korma, kebab, etc., the patient is not going to take any of these at all. So you should have to follow a prescribed balanced diet in balanced quantities along with some hunger enhancers in the form of progestogens. This is the way you can enhance a patient's food delivery or a patient's hunger so that the patient can take adequately and mitigate the requirement of energy in his or her body so that he or she doesn't lose weight. Now, even after that, the patient will continue to lose weight drastically. Why? Because the cancer is growing. If the cancer is not getting any form of treatment, the cancer will continue to grow. And for this rapid, enormous growth, from where it will take its supply? Definitely from the patient's diet. And always remember, the requirement of a cancer is much higher than a normal person. So whatever you are feeding that person, 90% of that energy or 90% of that calorie is actually going for the growth of the cancer instead of growth and maintenance of the patient's body. So how will you mitigate that? You have to treat the cancer. You have to stop the growth of the cancer in the form of chemotherapy, immunotherapy, surgery, radiotherapy, whatever it might be. But you have to treat the cancer as well. Only feeding the patient is not the solution. You have to remove or debulk the cancer as well to reduce its nutritional bypassing. The cancer cells should be minimized in the body or debulked so that the maximum amount of nutrition goes for the growth of the patient's body itself instead of growth of the cancer. So these are the basic things that you have to maintain in the mind while treating a cancer cachexia patient. This is the basic function of dietetics. And unless and until you maintain a proper body weight, you give proper nutrition and proper nutraceuticals to the patient's body, the patient is not going to tolerate the entire treatment. What I always say is that treatment of cancer is not a single instant or single contact incidence. It is a journey. Through that entire journey, your journey should be enjoyable. You should get enough amount to eat. You should enjoy whatever you are eating, and you should enjoy this journey. Unless and until you are getting enough calories, you are enjoying your feed, you are getting a psychological boost, this journey can never be a successful one, never be an enjoyable one. So always before starting the treatment of cancer, treat cancer cachexia first through dietetics. You can get connected with me and follow my posts, videos and blogs in my social handles given in the description box just below. If you want a personal consultation with me, please WhatsApp or call in the following numbers. My team members will personally get in touch with you as soon as possible.